These findings are important because chemotherapy had never been demonstrated to show any sort of benefit in patients who had failed primary chemotherapy. We have checkpoint inhibition therapy, which works in about 25% of patients, but we have no alternatives for those patients who either are not eligible for checkpoint therapy, in other words, they may have prior autoimmune disorders, or who have progressed after checkpoint inhibition therapy. So Ramucirumab docetaxel is an option which should be considered for these patients. In patients who have advanced bladder cancer, for standard chemotherapy, the survival is about 6 to 9 months, and the response rates are generally about 10%. With this combination, we've seen a doubling of the response rate to about 24% over docetaxel by itself. So from that standpoint, we're seeing an improvement in outcome. Chemotherapy, single-agent chemotherapy, generally is not effective as a second-line treatment. Our presentation at ESMO is focusing on the progression-free survival data, which was the primary endpoint of the trial. We're still awaiting the requisite number of events for survival. We expect that to be sometime next year. And we would hope that the survival data mirror the progression-free survival data for the combination. So that's our next step, but we clearly would like to look at other combinations in the future, use this as a backbone, potentially combine this with checkpoint inhibition therapy to see if we get a better result for those patients who have not received checkpoint therapy.